My name is Gabriela Silva and I'm going to talk about disorders of fluids and electrolytes, electrolyte and acid-base disturbances in patients with diabetes mellitus. Definition. Electrolyte disturbances are common in patients with diabetes and may be the result of an altered distribution of electrolytes related to hyperglycemia, induced osmotic fluid shifts, or of total body deficits brought about by osmotic diuresis. Application in medicine. Acid-base disturbances. Ketoacidosis results when the rate at which hepatic ketoacid is generated exceeds peripheral utilization and the concentration of ketoacid in the blood increases. The accumulation of protons in the extracellular fluids causes the decomposition of bicarbonate to carbon dioxide, and whereas the concentration of ketoacid anions increases. Sodium. Sodium elevations in glucose concentration increase plasma tonicity, creating an osmotic driving force that favors the movement of water from the intracellular space to the extracellular space, thereby diluting the extracellular concentration of sodium. Potassium. Hyperkalemia can caused by an increase in plasma tonicity that results from the redistribution of potassium from the intracellular space to the extracellular space. The efflux of potassium from the cells is due to intracellular dehydration, which results from the osmotically induced transcellular movement of water, which creates a favorable gradient for the efflux of potassium. Pros and cons. Pros. The treatment of diabetic ketoacidosis involves the administration of insulin and intravenous fluids to correct volume depletion. The primary goal of therapy of hyperkalemic acidosis tubular renal is to correct the hyperkalemia. In many instances, reducing the plasma potassium concentration will correct the acidosis. Cons. Hyperkalemia is frequently present on admission in patients with diabetic ketoacidosis, even though total body potassium is reduced.
Isolated or in combination. But even if they're combined, there's usually a primary problem that's more pronounced. In this session, you'll learn a simple rule of how you can resolve primary problem metabolic or respiratory behavior. So let's recap the different types of acidosis. For simplicity's sake, I cannot separate acute and chronic respiratory. As we said, in respiratory acidosis, CO2 is elevated as a reaction to glycol also in respiratory alkalosis falls and rises to also glycol. So you can see that respiratory change in temperature. Let's see what the situation is in metabolic. In metabolic acidosis, glycol falls, pH also. How about metabolic alkalosis? Here the glycol rises, which causes which also causes. As you can see, in metabolic problems, the change in pH and are in the same direction. And that constitutes a simple rule for identifying primary acid base problem cases. Let's check out. It's your turn now. Use your newfound skills to identify the please use the simple rule.
Issue applied in Ecuador. Since the high prevalence of diabetes ensures that clinicians in virtually every medical specialty will interact with these patients, familiarity with related electrolyte abnormalities is important.
Yeah, so I just mentioned that 9 out of 10 people don't know what the question is. How do they not know? I think the situation and how we react. Let me explain. I think the first and foremost reason that people are like that, right? So we can at least push them into their numbers and create understanding and bigger factor, right? That's really key. The second thing that I think sometimes we get your work back is understand it. So today we're gonna go through each and that's to kind of understand it, look at it, see, your scan of the program, whether you see it in the red or the green, that's considered the question. The third thing that happens, right, it may not, is that you it's really from effective medicine and the doctor's giving them a diagnosis and all that here is the right? So whether or not they've understood exactly, we're not sure. And then the fourth thing, and this is the main here, is you being a patient advocate, doctor, and I'm not sure if it's really fully alerting you each time you go into the visit issue if that's not the issue, right? So multitude of reasons why people may not go, but again, that's the reason, as you mentioned, there's a risk assessment test, creating awareness because prevent it and delay the onset is key.
Conclusion. In summary, the dysregulation of glucose homeostasis leads to many direct and indirect effects on electrolyte and acid-base balance, complications from an organ injury, and the therapies used in the management of diabetes may also contribute to electrolyte disturbances.
Hello and welcome to our YouTube channel. In this video, we are going to have make it simpler to understand. Break down the topic into two parts. The first part will look at the of the ketoacidosis, while in the second part we'll look at the clinical complication and laboratory findings that can contribute to the disease. Let's start with the first part of the ketosis. See, diabetic ketoacidosis is a sort of medical emergency which is associated with the type 1 diabetes. In the case of type 1 diabetes, there is absent or very low level of insulin. This decrease or absence in insulin main culprit behind the absence of disease. Let's see how. Now, since we have a decrease or absent insulin, there is an increase in the glycolysis, gluconeogenesis in the liver. Also, there is a decrease in the glycolysis in the liver. See, if insulin was absent there, this processes would have been slowed. Now, as a result of all these processes, there is a decrease in the blood glucose level, leading to hyperglycemia. This hyperglycemia leads to glucose and eventually we have polyuria because more glucose is lost in the blood. As a result of the polyuria, we go dehydrated and this will lead to bleeding also. Also, as a result of the lack of insulin, we get increased breakdown of fats, especially when there are conditions of stress such as sepsis or infection or any other stress. This is because in stress, the body needs a great amount of energy. So as a result of this, there is an increased breakdown of fats from a liposuction, which leads to the release of fatty acids from the bloodstream, which then go into the liver and are converted into the ketone bodies. Now it's important to know that as a result of the increased production of the ketone bodies, we get hemolysis. This is an increase in the ketone bodies within the blood. Then we get ketonuria, which is the spilling of ketone bodies in the urine. And since ketone bodies are acidic in nature, we get acidosis, which is high as ketoacidosis. And since this is due to diabetes, it is marked as diabetic ketoacidosis. This is the main pathophysiological feature of the diabetic ketoacidosis. Now let's look at the second part of the video, that the clinical findings and labs. See, diabetic ketoacidosis is a medical emergency in which patients will present with the symptoms.
Thank you.